Epilepsy is the tendency to have recurrent epileptic seizures. It's diagnosed after at least 2 epileptic seizures have occurred. And an epileptic seizure is a change in movement or behaviour and/or awareness, the direct result of a change in electrical activity of the brain. We know that about 80% of children with Angelman's will have epilepsy at some point.
They're slightly more frequent in the Angelman children who have deletions compared to the other groups. So often children with Angelman syndrome start with their seizures around about 12 to 24 months.
They don't grow out of the epilepsy, and are likely to need lifelong treatment even if they respond to the medication. But certainly it is less problematic as they get older.
It often improves and even remits at the end of the first decade, but it can then come back again towards the end of the second decade as well. Epilepsy can be affected by environmental factors, so sometimes it can be triggered by tiredness or illness or constipation, or sometimes excitement or stress or agitation. So all of those sorts of lifestyle issues need to be taken account of. Often it will start with febrile convulsions, that's quite common, so seizures that only happen when the child has a temperature.
I must admit I didn't recognise it as epilepsy straight away because it was so associated with him being so quite unwell at the time, and but it was only a bit later on when I realised it must be epilepsy.
They're very hard to recognise, so we spent ages wondering, are these seizures, are they not? So we had several tests trying to catch the seizures. We couldn't until he went into status where he was having constant seizures, and then that was easier to diagnose.
It can be very difficult sometimes to note whether episodes that Angelman syndrome children actually experience are indeed epileptic, because they have the jerkiness, which is more of a movement disorder.
Doctors didn't believe us, and a good way to prove it is to actually film the child while they're having a seizure.
So the diagnosis is based really on the history, what happens during an event, and maybe on the video as well, more than on medical tests. So there are what we call tonic-clonic seizures, which is what everybody thinks of when they think of an epileptic seizure, where a child will go stiff, lose consciousness and fall and convulse all 4 limbs. That can happen. There are absent seizures, where a child just seems to stare into space, just often very subtle, often many times a day. Sometimes they can have jerking episodes or myoclonic seizures, and that can show sometimes as head nods. And then there are other seizures called focal seizures, where one or other part of a body twitches in a particular way, often associated with impairment of consciousness. So those are the main seizure types. There are other rarer seizure types as well. And a child can have one of those or a combination of them. It's important to mention non-convulsive status epilepticus in Angelman syndrome. That's quite a subtle form of seizure, where the child will often just not be themselves, be a bit vacant, be a bit maybe jittery, maybe drooling a bit, be less aware than usual, and it needs a different treatment. The seriousness of that is that it often leads to developmental regression, so we want to treat that as soon as we can and recognise it as soon as we can.
The seizures in many of the children with Angelman syndrome will be controlled with medication. It's getting the medication right and knowing the right combination for that individual. It's infrequent that children with Angelman's need hospitalisation. In children with Angelman syndrome who are resistant to first-line medication, we can consider dietary treatments such as the ketogenic diet, where you use more complex sugars, and by default there is a higher fat within the diet, has been utilised in Angelman syndrome with success.
In most cases we can manage it, that the child can be seizure-free, in most cases. And in those cases where it's difficult, that it may well get better with time, but that we can usually take the edge off it, at least, even in those cases where it's really difficult.
There are of course a lot of children with Angelman syndrome who will never have a seizure, so it's not a foregone conclusion.
It becomes a normal part of your routine, not necessarily your daily routine, but something you just learn to deal with. It's not as traumatic, it's not as debilitating as you might imagine it is before you come into the situation.